Doctors say as numbers in Black and brown communities continue to skyrocket, something needs to be done. A new grant awarded to UC Davis Health will help train more people to be contact tracers, specifically for the Latinx community. KCRA 3's Leticia Ordez talks to Dr. Sergio Aguilar Gaxiola about how this new workforce could help stop the spread of COVID-19 and save lives.
What will this mean for our community during these difficult times?
In California, as you know, we have the largest number of cases, and it is disproportionately impacting, vulnerable populations. And I'm thinking specifically, I'm talking about Latinos and also African Americans. This should give us pause about the gravity of the situation, especially on the essential workers, who are in so many sectors, from agriculture to service, to construction, to health, as well as other sectors that are being particularly hit. Several efforts that have been made here in California across the state to have, let's say, an army of contact tracers, they haven't been as effective as they could. And many of us think that it is because they either don't speak the language or they don't know the culture, and that those who are to be served by their services just don't relate to. In all of this, about controlling the spread of COVID-19, trust plays a key role. And if those who are receiving testing and those who are giving their personal information, and if they are come back positive, and if they distrust those receiving the information, they are not going to be willing to provide that information.
Exactly how will this work? Does there have to be a case identified and then a contact tracer will go into that community and find out where that person has been?
I think that the ideal would be that since the moment in which the testing is being done, to establish a trusting relationship, having contact tracers who look like the populations that they are serving and that can effectively communicate with them is of critical importance.